Hi everyone, welcome back to Instagram Live with Intimate Rose. I'm Dr. Amanda, and today I'll be joined by Andrea Martin, nurse practitioner specializing in hormone therapy and menopause. And today our topic is vaginal estrogen and its effects on the pelvic floor. So Andrea is going to be jumping in any moment now to join us. And if you have any questions, please don't hesitate to put them in the chat and we will be sure to answer them. And if you're experiencing this after we've recorded, you can throw them into the comments section. Andrea is coming through any moment now. Hello.
Hello.
How are you?
Hi. I'm good. How are you?
Doing very well. Additionally, we have a code today to share at the very end of this video that will be good for 10% off for people viewing for 1 week following this live recording. So don't let me jump off of here without sharing the code.
Okay. I'll try my very best.
Today, our topic is local vaginal estrogen and the pelvic floor, and how those two different factors can affect incontinence, vaginal health, overall well-being, comfort during intercourse.
Yeah. I decided I'm gonna break down the pelvic area in 4 parts. We'll basically talk about muscles in general,
Oh,
the vagina, bladder, and then bowels. Oh, hi there.
I
Hi,
brought this
pelvis.
so as you're talking, I can Vanna White.
Welcome to the party. And and some of this stuff, we'll talk about estrogen, vaginal estrogen can help. Some of it doesn't make a difference on. So I'll kind of, let you guys know because I think sometimes that can be confusing. What will estrogen help? What does it not make a difference on? So our pelvic floor in general, which you just so graciously showed us, this beautiful ball of muscles that sits between our hips and is involved in so much, you know, breathing, sitting, standing, peeing, pooping, sex, pretty much everything. It's the bottom part of your core. And we have estrogen and progesterone receptors all over those muscles. And when we go through menopause and we have that decline in hormones, it can impact, the integrity and the function of the pelvic floor. So one of the things you might see is decreased tone or decrease in the quality of the connective tissue. So that can lead to something called pelvic organ prolapse, which I'm sure you are very familiar with as a pelvic floor physical therapist. And that basically happens when you've got this weakening of the support structures in the pelvis, and your organs can shift around. So your bladder can kind of fall into the vaginal space, the rectum can kind of push up, the uterus can come down. So a little bit of shifting, bulging type feeling. And I'll also note that some of this stuff I'm talking about, we're saying specifically how menopause relates to it. There's various other things that come into play here too. It's not just menopause that is, puts you at risk for pelvic organ prolapse. It's really more so age and, obesity, chronic constipation, things like that. So a lot of times patients will ask me, okay, I have prolapse. If I apply vaginal estrogen, will that make my prolapse go away? And unfortunately not. We don't really have evidence that it can make the prolapse go away, but we do know that kind of those declining hormones in the first place does play a bit of a role. And I want to throw out there too, we always think, oh, you're getting older, the muscles get weaker. We also have the opposite problem where the tone gets way too tight. That can be in response to an injury, pain, or even changes in the vagina where the skin itself starts to change and gets painful, and then the muscles underneath start to kind of spasm and be painful. So muscles can do all kinds of things, not just be weak. So talking about the pelvic floor and even how the vaginal tissues can influence that. So let's talk about our friend the vagina and her close relative, the vulva. I was like, wait, it's outside. That's the butt. I thought you were going to the rectum first. I was like, you got it wrong, Amanda. Just kidding. Correct. I will say, funny story. Back in the day, I used to work as a vet tech, and the first I had to get a cat's temperature and I lifted its tail up, and I was like, oh God, which hole is it? I was trying to picture, if I flip this cat around, which is the butt, that way or it's underneath? So we all get confused sometimes about which spot is which. The vagina, obviously, we have skin that lays over it, and when you have decreased levels of estrogen, the skin gets less stretchy, it gets drier, there's less lubrication, and that can certainly lead to pain with sex. We see that a lot with patients. And good news here, vaginal estrogen is your best friend here. That is going to take such good care um, of the vaginal skin. It really, like, number one job that it does, it's fantastic with helping with vaginal pain and dryness lubrication. So I always recommend that. All right, so now why don't we talk about the bladder? Do you have a bladder over there?
I do.
What you got in your bag of tricks? There she is. And the top even pops right off. There's the inside. So studies do show around, midlife that we see a peak in urinary symptoms. Um, but again, age in general is more of a risk factor for a lot of these urinary symptoms. I think it's something like 40% of women that are 70 years or older report some type of urinary incontinence. And no, that's not normal. It's common, but it's not normal. I'm sure you see that all the time where you ask people, do you leak, do this? And like, oh yeah. Or sometimes they don't bring it up at all. And then I ask specifically, are you leaking urine? Well, yeah, but everybody does after you have a baby. Not necessarily, you don't have to. Um, but specifically related to menopause, we find that women actually tend to have a smaller bladder capacity. So you took off the top, you showed us the space that's within the bladder. So what happens is, our bladder fills up, and at a certain point, we get that signal like, oh, I got to go to the bathroom. So if your bladder capacity is decreased, you're getting those signals much more often. So that results in frequency and urgency. Um, the decrease in estrogen also affects the detrusor muscle that surrounds the bladder and kind of squeezes it. So if that's overactive, you're again going to get more of those prompts that you have to go to the bathroom more often. And we know that estrogen deprivation, which happens after menopause, it changes the tissues in the urogenital tract that can lead to worsening incontinence. So, frequency, waking up at night because you have to go to the bathroom multiple times, urgency, um, even recurrent urinary tract infections. I was actually reading a study yesterday that, well, it depends on which study you look at, but vaginal estrogen can reduce the risk of getting a urinary tract infection in a postmenopausal woman by 50 to 90%, which is a huge, huge amount. So that's another really important reason to use vaginal estrogen postmenopausally, because not only does it help prevent infections, it decreases sensation of urgency, frequency, waking up at night. Are you drinking coffee?
No.
Oh, okay. I was like, okay, what kind of tea? I was like, we're talking about urgency here.
It's
You're just chugging down caffeine.
there's no caffeine in my tea, nor is it wine.
But maybe it should be. So yeah, bladders don't tend to like caffeine, but you got to do what you got to do. I never tell people they can't have caffeine. That doesn't go over well. So yeah, when it comes to bladder symptoms, A plus for vaginal estrogen. So now it's time to talk about the bowels. Do we have any of those? Please remove your bowels. There she is. Poop comes down the chute and out the rectum. So I will say the one bad news about our bowels in menopause is that we do have an increased incidence of like accidental leakage of bowel contents. And we think some of that is, due to decreased anal sphincter tone. So that's kind of the doorman, at the bottom of your rectum that allows things to go in or out. So if there's weakness there, that's easier for it to have leakage. But I finally have some good news here. Each section I've been like, well, then you go through menopause and this happens to your muscles, this happens to your vagina, but there's something that's actually good that happens with your bowels in menopause. We actually see for patients that have chronic constipation, that improves in menopause. Don't ask me why. I don't know the logistics of that, but the studies show that patients with chronic constipation tend to have an increase in bowel frequency, which is good if you've been struggling with that. Decrease in hardness of stools, and less straining. So, finally, something to look forward with menopause if you do have those symptoms. And vaginal estrogen, no real impact on that we're aware of. So, it's good for your vagina. It's good for your bladder symptoms. No real evidence at this point that it would make any difference in necessarily in bowel symptoms or in the muscles themselves. So there you have it. I see comments. Somebody said brains like caffeine.
Yes, and another comment about, is caffeine not good for vaginal dryness?
No, I don't think there's any data on that. So have have your caffeine. If that's your main concern, I wouldn't worry about it. It's not necessarily going to have an effect on that.
So I think she's wondering why you were getting a little agitated about the
Oh,
possibility that I was
because
drinking
we were talking
caffeine.
about
And
bladders. Because
that pertains to the fact that caffeine is a bladder irritant.
yes,
So we do recommend it in smaller amounts, especially if people are experiencing urinary frequency or urinary incontinence. But again, like Andrea said, and likewise, I don't take away caffeine from patients, but recommend it in smaller doses. So keeping it more to like 1 cup a day instead of one
yep,
pot a day.
exactly. And I always say we give you the information, you decide what to do with it. So some people are like, I love my coffee. I love it. I love it. I wanna have it, a whole pot a day. And I'm like, that's fine as long as you understand the consequences. And some will be like, I don't care. I can stay home in the morning for however many hours and I know it gets better after a certain point and then I can go out. So you gotta do what works for you. I know that there are a lot of brains that enjoy caffeine. Helps us get started with our day. Yes, I'm sorry for my freak out. It does not affect the vagina.
To clarify, Amanda knows where the vagina is.
I know it was the way it was tilted at first. I was like, oh no, she's pointing at the rectum. You were not. Amanda knows very well where the vagina is.
Any other points that you'd like to make?
I don't think so. I think that's it. It's just nice to know. I think there's so much information out there and it can be very overwhelming. um in some aspects. I think sometimes some people kind of overstate the benefits of estrogen and some are understating, so it's nice to just kind of see, look, this is what it's going to help and this is what, at least at this time, we don't have any evidence that it would help.
So a key point of that is that because, as you stated, muscles can be too tight, they can be too weak, the process of either building strength or improving flexibility and mobility or improving the coordination between them when the brain says go and the pelvic floor muscles fire, that's where we as pelvic health physical therapists and occupational therapists come in to help manage the mechanical or musculoskeletal aspects of bowel, bladder, and sexual function as well. So it's important to recognize that estrogen is really helpful for improving vaginal tissue and the effects that it can have locally. And then with the training of the muscles, just like if you injured your rotator cuff or hurt your knee, that training comes with pelvic therapy as well, and that they work really well as a team.
Yeah, i, I think that's a great point to make. Like I said, if estrogen helps your vagina, your bladder, things like that, there's so much more that a pelvic floor physical therapist and doing pelvic floor physical therapy can help you with, including all the things on this list. And just pelvic floor physical therapy is so underutilized. You guys are geniuses at this stuff. I don't know how any of us would do our jobs if we didn't have you. So it's just highly recommend it.
Well, we're happy to help. And if you are having trouble accessing a pelvic therapist in your area, we here at Intimate Rose now offer online physical therapy via telehealth. I think we have a couple occupational therapists that are coming through the process as well, but that is something that we're currently offering in over 20 states. And we are here to help you from the comfort of your own home. Someone's asking, can you talk about vaginal atrophy and how to improve it?
Sure. So vaginal atrophy is simply the changes that happen to the vaginal skin, but also, again, the bladder, the urethra, the vulva, so the outside, even the clitoris. All those areas of tissue are very much affected by estrogen. Oh, there she is again. And estrogen is such an important hormone for those tissues because it keeps them healthy. It helps, increase blood flow. So whenever you've got a decrease in blood flow after for any situation, but that's what happens with menopause, obviously, you're not going to have as healthy of a tissue. Um, and honestly, the best way to treat vaginal atrophy or any of these genital urinary symptoms is with vaginal estrogen. Um, so again, the estrogen itself increases blood flow, lubrication. It helps keep the pH normalized, so you're at less risk of urinary tract infections and vaginal infections. Um, and it comes in different forms, so you can get it in like a vaginal insert, cream, comes in rings. We have it available through telehealth with Intimate Rose. You can sign on there and get prescribed the vaginal estrogen. You can also work, with your own clinician. Sometimes family medicine does it or internal medicine. OBGYNs absolutely should. Um, Even urologists sometimes are now starting to get on board on the vaginal estrogen train. But it's super safe and almost like stupid easy. The difference it makes where I see patients come in that they're just like, oh, I'm dry, I'm itchy, sex is starting to be uncomfortable, my bladder, this and that. And then they come back in 4 weeks later and they're like, I did not even realize, how bad I felt until, now I got this estrogen and I feel so much better.
Absolutely. And the keyword was should. So if they're not, and if you don't feel heard, that's where pursuing other possibilities for providers is important.
Yes, yes. And I will say there is almost no one that vaginal estrogen is not safe for. There's a ridiculously small percentage of, there's one certain type of uterine cancer that's extremely rare that I wouldn't even say, oh, you shouldn't have it. I would say have a conversation about it. But pretty much everybody should be offered vaginal estrogen if they would like it.
Here's an ingredient question. Does vaginal estrogen contain methylparaben?
I'm not 100% sure. So the estrogen itself, no, it's estradiol. It's the molecule, same thing that your body makes, depending on which brand and type you go with, what they then mix it with, whatever vehicle they use to then, get it into your skin, that would depend. Um, but I don't know off the top of my head if you do find that there's certain formulations that do have that in. Like I said, you can look for the cream, and there's different types of cream. The inserts, there's also various types of inserts, probably at least like three or four. Um, and then vaginal rings that hold the estrogen in, that you just put in your vagina. So I would hope in one of them you might find your good option for you that doesn't contain that.
Very good. Does anyone else have any other questions before we conclude? Andrea, any other points that you would like to make?
Um, no, I think that was pretty much it. I just like people to be aware of changes that might occur um in menopause and with the pelvic floor. I think a lot of this stuff we don't talk about enough. I certainly hear that from patients a lot, especially prolapse. That can be a very scary thing. And, I've had patients calling like, oh my God, my organs are falling out. Like, do I need to go to the hospital? It's just, and of course, that's a terrifying thing when you have no idea that it can happen and nobody really explains to you what is happening. So I think awareness is important and knowing that there's plenty of stuff that you can do about it.
Yeah, in pelvic physical therapy, we treat prolapse. We can help reduce the grade of the prolapse. We can teach you how to manage your system, like your body, how you breathe, your pelvic floor when you lift your groceries, when you lift your child, when you're going to exercise or do whatever you're doing so that the symptoms are less. And we can also help to ensure that you get support for those more progressive states of prolapse with a pessary as well.
And I've certainly had patients, even with significant prolapse, that after going to pelvic floor physical therapy, does it make, like I said, does it make your prolapse go away? No, you said you can possibly reduce it some, but even for those that it didn't necessarily reduce, I've heard a lot of like, I just feel better. I'm not as aware of it. I'm more comfortable. I know how to manage it now. Um, So I think sometimes people get scared that surgery is the only option, but it's really not.
Yeah, yeah, and generally not.
Yeah, yeah.
If using cream, where do you apply? Internal, external? Question mark.
Yes. I would say both. The part that is the most symptomatic is right around the opening of the vagina. So it's like the outside of the inside. It's yep, thank you. It's like right between the two worlds of internal and external. I have my patients apply some all the way inside their vagina, just a little bit, kind of swish it around there, and then take another little blob, spread it around the opening. You could put it on the labia, the clitoris. There's really no bad place for you to put it. Cover all the things.
Does standing for 8 hours a day at work expedite prolapse? And the answer is no. It's how you manage your body while you're standing. So the nature of standing and being active does not cause prolapse. It is if you are bearing down or using excessive downward force or not breathing, holding your breath when you're going to lift or move. Other factors like your medical history, hormone status, like Andrea pointed out, birth, pregnancy, the number of times you've had a episiotomy or C-section, all of those things matter as it pertains to prolapse. But standing on your feet for 8 hours a day doesn't by nature cause a prolapse. Other questions? Lots of good ones today.
Oh, we did get good ones.
All right. Well, thank you so much for your time and expertise, Andrea. We sure appreciate you.
No, thank you for being here. You are the pelvic floor expert. So anytime you can chime in, everybody learns.
Thank you. All right, everyone. Have a great rest of your day, and we'll see you next time. Oh, no, the
Oh,
code. The
oh,
code is
I started to think
estrogen.
that, and then I was like, no, she did say it.
The code is estrogen. It is good for 10% off from today through the end of next week. If you are accessing this video anytime between today, which is May 15th, 2025, and 7 days from now, you can experience 10% off with the code estrogen on all of our pelvic health tools.
I failed. That was the one thing I was supposed to remember.
I need different colored stickies. They need to be brighter. It's blending in.
I literally started to say it, but I was like, no, I'm pretty sure we talked about it already. All right, well, we're just
There we are. Code is estrogen.
code
All
is
right.
estrogen.
Have a good day,
Bye.
everyone. Bye.